so we'll be discussing case 4 now, which was titled A Clash of Cultures. Here we met Mr. and Mrs. O, who are living in the United States and bring their 6-year-old daughter to Dr. Samuels, requesting female circumcision, which is a traditional and common practice in their home culture. And Dr. Samuels is initially taken aback by the request. However, through the urging of the rest of her healthcare staff, Melinda, who's her social worker and is also part of the community, the same community as Mr. and Mrs. O, Dr. Samuels is ultimately able to listen to the reasoning and background behind Mr. and Mrs. O's request. And we're kind of just able to see the progression of each of these individuals' thought process surrounding this procedure.
Okay, so I will be discussing scope of practice, the first question. For this question, I viewed it through more of an ethical scope of practice than a general hands-on scope of practice. So for Dr. Samuels, the pediatrician, the physician's scope of practice includes ethical oath they assume when becoming a physician, which is to do no harm. In this scenario, it is not applicable for the physician to judge or place bias on the parenting of the patient's family based on differences in culture, but instead consider best possible outcome options for the patient. The nurse, Barbara, as the nurse, Barbara is aware of the cultural aspects of her patient's family and considering that when being asked to report them to Child Protective Services. Furthermore, as the nurse, and in accordance with provisional code ethics of ANA, the nurse must act with compassion, inherent dignity, unique attributes, and remember the commitment to the patient. And that can include not only the direct child, but the family as the patient, and promote and advocate for patient rights, safety, and health. The nurse would then, based on ethics, be responsible to advocate for the patient to have the procedure or not, based on best possible outcomes for them and those considerations. The nurse would also provide guidance and teaching to the patient and family regarding the procedures and any alternative options. The social worker, Melinda, in accordance with the scope of practice, it's a practice of a bachelorette social worker applying social work theory, knowledge, methods, ethics, and professional use of self to restore or enhance social, psychosocial, and biopsychosocial functioning. This also includes generalist practice and may include interviewing, assessment, planning, intervention, case management, medication, counseling, support counseling, consultation, education, advocacy, community organizations. It's very broad. There's a lot that social workers are providing for their patients. And so their obligation would be to educate the other professions on the unique social aspects of the clients and to consider the needs in the plan of care. And the social worker advocates in this scenario for the differing cultural practices to respect dignity and their decision to seek medical care.
So for my question, I was asked to look at what role interprofessional teams having in engaging the parents' personal feelings aside. And so kind of in a similar vein to what Courtney just outlined, but for me, as I was looking at this case, I think it kind of actually portrayed a pretty good real life example of how you want an interprofessional team to function. So if you see, there's definitely a perspective from Dr. Samuels, and there's definitely a perspective offered from Barbara and Melinda as the nurse and the social worker. And I think what's really important in this case is learning to at least understand and try to understand what the parents are coming at in terms of their own cultural background, in terms of what their beliefs are, and in what kind of setting it is. Because as we live in the United States, it's obviously a different culture and cultural setting than a different foreign country. So I think it's important to at least be willing to engage and just having that discussion versus just kind of coming into it with a narrow scope of mind. So yeah, I think they kind of portray it well in terms of just our role as an interprofessional team is to also see exactly, what are the motivations and kind of underlying cultural background of the parents, and actually getting them to discuss that and kind of offer perspective on that.
So my question was, is urging the social worker enough? I feel like we couldn't really answer yes or no in this question. It's the social worker's job to protect children and support families. But in this situation, I feel like the providers need to work better as a team, kind of come down to deciding what is the right thing to do and like who to inform. If the physician finds the situation to be like super urgent, he himself can contact the child protective services instead of going through the social worker route.
So the next question discusses which authorities need to be notified. In Texas, FGM is illegal, so it's mandatory for healthcare professionals, social care professionals, and teachers to report it if there is suspicion of this practice being made. So generally, the first steps would be to assess the risk to life, and if there's immediate risk to life or harm to the patient, which is usually the child, the healthcare professional can call the police, and if not, then they can just report to Child Protective Services and then follow up with the tip line as well as the National Child Abuse Hotline to further find which follow-up steps are needed to kind of give a complete report for the case.
Question 5, what do you think about the terms female circumcision, modified female genital mutilation, and female genital cutting? I believe that the discussion of this topic is sensitive to many people and cultural groups. In the United States, female genital cutting is federally banned in 1996 and is seen as unethical. However, in some parts of Africa, the Middle East, and Asia, female circumcision is very common and represents numerous ethnic beliefs. In this case, the patient's parents have concerns for future marriage proposals, which is consistent with numerous beliefs surrounding the culture of female genital cutting. Many men refuse to marry intact women, and it is sometimes stated that the purpose of female genital mutilation is a rite of passage in certain cultures.
In terms of the role that cultural sensitivity plays in this case, the principles are similar to what was discussed earlier in terms of being able to keep an open mind and listening to Mr. and Mrs. O as they talk about this practice that's common in their culture and listening without bias, that you had going into it. Additionally, being able to know what you don't know and asking the questions to address those knowledge gaps is a key part of cultural sensitivity as it relates to this case. But where you draw the line is obviously this is illegal now in the United States and punishable by up to 5 years in prison. But even in a setting where, let's say, this wasn't illegal, your obligation would be to obviously listen and learn as much as you can. But through kind of the principles surrounding conscientious objection, be able to counsel Mr. and Mrs. O that this is something you don't feel comfortable performing, kind of educate them on the risks that this procedure has for their daughter, both from a physical health standpoint, but also from an emotional health, and then help them seek out any practitioners who would be willing to do it in a setting where obviously this is, illegal now. But yeah, this concludes our discussion for this case.